So thanks for the call, Ben.
You're welcome.
Perfect. We got everybody here. Okay. At the onset of the meeting, I wanted to say that, first, thank you guys for all taking your time today. I know your time is extremely valuable, and so I thank you for that. We are going to try to make sure that this meeting is brief because you all have so many things to get back to, but this is an important meeting where we're going to be talking about the Senegalese community and what the efforts of what you guys are doing with your nonprofit. So before we get started, let's make sure we do a quick round robin so we know who's on the call and just a quick intro into what you're doing. So how about we'll start with Ben.
Hey, how you doing, everybody?
Excellent.
Doing well.
Nice seeing you, and I'm sorry for the little late. I was waiting for somebody to put me in. My name is Ben Jeju. I'm the General Secretary of the SIDMV Association, which is a non-profit association based in Maryland, Montgomery County. So actually, my work is just to take care of all the paperwork in terms of administrative and relationship with external entities like organizations, non-profits, and all the activities that we handle. So yeah, I'm here with Modi. I'm gonna let him talk about him.
Oh. Hi, everybody. My name is Modi Ndiaye, president of the Senegalese Association of the DMV. Ben said it all, so he's the one. I'm the one probably who's just gonna give orders, and he's the one who's gonna do it. Just kidding. Yeah, basically, yeah, I'm the president of the association, and like Ben said, we are a non-profit organization, and then our mission is to foster interaction and unity, solidarity among the members of the Senegalese community and the Friend of Senegal. And also we want to introduce Senegal and its rich culture to the rest of the greater metropolitan area and to the United States as a whole. And what else we do? We work to improve the mental and physical health of our members through activities related to sport, fitness, nutrition, education, and culture. And more specifically, we are trying to alert the community about, consequences of obesity, chronic diseases, just like high blood pressure, diabetes, and high cholesterol. And the last thing we do also, we support charitable project directed at improving health and well-being in Senegal. That's what we do, basically.
All right.
Nice to meet everybody.
Thank you. Thank you. Roberto.
Yes, talk about emergencies, and excuse the. Anyway, Roberto Rodriguez, director for the Silver Spring regional area, one of 5 regional areas in the county. I am, and he'll introduce himself later, Kent Hartman's counterpart in Silver Spring. For the purpose of the COVID-19 response, Ken is leading the effort, and I'm working with him on that.
Thanks, Roberto. Ken.
I think he's
Ken?
mute.
Oh, okay, Ken, are you still there?
He's on mute.
I'm here. I'm gonna have to switch to another device. I'm having everyone streaming in this house right now.
Oh, okay. Okay. You're welcome to call back in, Ken, if you need
I'm Ken Hartman. I'm the regional director for Bethesda Chevy Chase. I'm Roberto, but west of Rock Creek. I've also been tapped to lead the community engagement team, including Roberto and the Office of Community Partnerships on multicultural, multilingual outreach during COVID-19. So I'm coordinating with everyone, with Roberto, with Harriet, with Diane, and we're all trying to get the message out and partner with organizations such as your own to help wherever we can to provide information and to receive intelligence and advice on where we should be focused.
Wonderful. Thank you, Ken. Harriet.
Hi, I'm Harriet Shangarai, African Community Liaison here in Montgomery County, working to reach out to communities, especially during these unprecedented times. Recently had the pleasure of speaking to one of the members of the Senegalese task force, so I'm very proud and happy to hear and learn about their work, meeting their leadership team. Also, reaching out nonprofit, faith-based organizations, see what has been done, see how to streamline activities, identify the gaps, see how we can support and make sure we connect them to county resources. So I'm here to support and help. Thank you.
Thank you, Harriet. Let's see, Jessica.
Sure. So good afternoon, everyone. My name is Jessica Clark. I'm the Deputy City Manager for the City of Tacoma Park. So I work very closely with our City Manager, Suzanne Ludlow, and our Mayor, Kate Stewart. This is actually my third week on the job, so I've started in the middle of the pandemic. It's certainly been a whirlwind of a couple weeks as we try to understand the needs of the Tacoma Park community in this crisis. And so these types of connections are very helpful for us in understanding how we can improve city services. And I think these type of partnerships are going to be very important in the months ahead. So I look forward to learning more about what your association is focused on and how we might be able to help through our city services. And I lived in West Africa for 2 years also, so je parle français, alors si ça peut être utile pendant les réunions, ça peut aider.
Good to
Oh, wonderful. Well, I can't follow up with that, but my name's Eric Rosh. I'm the operations manager for the Silver Spring Civic Building at Veterans Plaza, and I have the pleasure of knowing Ben and Modi through their Senegalese cultural festivals here at the Civic Building and the good work that they're doing in the community. So when they briefed me on this, I said, I would love to be able to share your report with others, and I thought immediately of Ken and Harriet, the work you guys are doing along with Roberto. And so that is what kind of led us to this meeting, because we know that the COVID-19 public health crisis is still in dire need for support and proper communication. And so with that, I'm going to turn it back over to Ben and Modi. And if you could just brief us on the stuff that you're doing right now with the Senegalese community, and then we'll open it up for questions and dialogue after.
Yeah, I'll let Ben talk because he's coordinating the efforts. But Ben, go ahead.
All right, thank you so much. Actually, I'm the coordinator of the task force. We've been talking when since the first day one, when we realized that the COVID-19 is here for, it's going to be here for a while, and people started to struggle about the jobs, about the schools, and a lot of different things. So since we have a community, a wide community that people, most of the time, they work as a babysitter. Some of them work as a cab driver, and few of us work in the offices like as IT people and stuff like that. So we were like, there's some things to do. We cannot let people like in this situation and wait for the federal or the state take care of the population. So we, as a non-profit organization, since we do a lot of activity, and our activities is based on the presence of people, of our members, and a lot of communities. So we have to give back on those people. How to give back is just to come show them our presence, show them our support, show them that we're here by giving them a symbolic support, whether it's financial, moral, or social. So we get together. We have a community radio show where we put information and keep people updated about what is going on in nationwide, but in citywide and county-wide. So in one of the show where people call in and start like explaining their concern about this COVID-19 and how they are struggling. in our community, people, they don't tend to tell what they feel. They don't tell you their sufferings and stuff like that. They just keep it on them. So when we realized that a lot of people came out and tell us the real situation people are living in, we just step up, Modi, me, and Pop, and I think we were 5. We say, we just call all the organizations, Senegalese organization, and let them know that this is the situation and we need to act right now. There's no time to wait for. We need to act right now, and we don't have to wait for somebody else to come. We just have to put our ideas in place and roll in. So the idea came to put a task force. The task force consists of 7 associations, and ask each association to contribute with a $500, and it came up with 3,500, right? Mm-hmm. And then put a fundraising, what do you call Facebook fundraising, mm-hmm. and
GoFundMe, basically.
GoFundMe. And then we raise funds, add it to the factor that we have on table from the association, and then put in table the strategy we're gonna use to give back the funds to people that is in need. So we have a coordinator that put with the task force consisting of 19 people. And those 19 people, we divide them on 3 committees. The committee of communication, consisting of 2 persons, the committee of control and finance, consisting of 2 people, the committee of information, consisting of 2 people, and health and medical advisor. And then we have the backbone consisting of a collection committee. The collection committee is the people that go there to the base and ask people, take the information from people in need. When they got those information, they take it and they have to classify them by prioritize and shall agree upon the selection of the recipient and compliance with internal policy and procedure to be approved. Once they approve it, they take it to the finance, and the finance, when they do they check, analyze, and then do the final decision. They have to take it to the treasurer, who take the money to the people. Now, some of them they ask for the financial help. Some people ask for some grocery stuff and material. So based on the request of people, we just call the committee of distribution that take the money or take the grocery to those people. Basically, what we do is just take the money from people that are in this situation, still working, still making a little, and take that, give to people that are literally with nothing, just not working, staying home with kids and stuff. And that is working perfectly. And that's what we've been doing with our community. And we think it's a little, but it still helps, and people are getting the help.
Wonderful, wonderful. Modi, do you have anything to add?
Yeah, I think, like Ben said, our focus is like those people who don't, first of all, who don't have the documents, and then those people who basically breeders, and then not cab drivers sometimes, but people who don't have documents. Those are our priority, basically. So the government is not giving them anything. So, so I think that's it. So.
Okay, that's great.
Also, Eric, you mentioned that we have an information committee that the task is to go out there on the county, on the cities, on the federal wide to bring the information for the resources. We give it to people so we can go get these resources where they are and bring it to people. Like when I say resources, it's just a grab and go. When they give food in the Montgomery County, they give it. So we give them the link, we give them the information so they can call in or they can stop by and pick up some things, and sometimes it can be people that are registering are an employee, sometimes they come back and saying that the server is crashed we cannot get in. We wait. They told us like to wait. I've been waiting for 3 days. We told them to understand that this is very unprecedented. People, the unemployment rate is very high, and the government wasn't ready for that. So the system has to be improved. They have to work back on it. We have to be patient. We have to be, very patient, and then come now and get to the community, see what is the little resources there in the community, and use that for now. And while they wait for the help in a wider level.
Well, I know Ken is very close to the work that you guys are doing, and he's experiencing it in different ways. I think he wanted to ask a question or jump in and talk. So Ken, are you still with us?
I'm with you. I just jumped on another device. So I do have to say that we hear you about folks who are undocumented. It's what the message that needs to be made loud and clear with regard to COVID-19 care is that there's no penalty for seeking care at one of our Montgomery Cares clinics. It is not. No one should avoid seeing a doctor or not report symptoms if they're feeling sick. We want everyone treated. The other thing you should know is we are rolling out the individual assistance program, which is designed especially with folks who are undocumented or who may fall through the cracks for state and national assistance. The first group of people should be receiving checks over the weekend, and these are people who are already in who are already known to county service agencies, who are maybe involved in support programs. If there are other people who we don't know about, who are not known to our service providers, we're going to be reaching out to our nonprofits to help identify who they are, so that we can make sure that they're supported in the next batch of funding. So the first batch of funding is going out, should be starting over the weekend to people we know. And the next batch, we're going to be working with nonprofits, and we're going to have to make sure we include your association to make sure we're not forgetting anybody. If there are people at home who are not working and who are undocumented, we want to make sure that they are receiving assistance as well. And for just so you know, for all of our county programs, we don't ask for documents. We serve all residents with all of our programs.
So Ken, just to make this clear, for the quote unquote people we know, that means that they've already participated in some kind of a county program in the past, and their information has been captured. Is that fair to say?
That is fair to say. Yes.
Okay. Modi and Ben, thoughts on that? Do you guys know of people that are in the system already and those that are not? Is that something you guys have parsed down and got into your data?
The fear that people have sometimes, they don't want their information to be there, like people like undocumented people. So that's one barrier that we have to struggle with. Ben can tell you about it. So because they have that fear. If you tell them, the first reaction is just like they don't want their name or their information to be known.
What are they trusting you if you
Yeah.
You would be the one that would say, "Hey, look, I know you may have some hesitations, but we're working with this agency, and you're in good hands." Is that
that's something that we can do, because people, they tend to talk to people they trust.
Yeah.
And I have a lot of them. Ben also can say the same thing. So they tell you, okay, I can talk to you, but they cannot be in a grand scheme of meetings, and people that they don't know or something like that. But yeah, there's something that definitely we can do.
Okay, Ken?
Yes, Eric.
Did you have more to add in any other way?
We also have a wide range of literature we can start to share with you in multiple languages, including French, that's geared towards healthcare, COVID-19 symptoms, the basic messaging about staying at home and wearing a mask. We have a range of graphics and also more detailed information about what renters should know and what their rights are in multiple languages. We can start to share out to you for the Senegalese population.
Yeah, we definitely need that because right now we're out of, we're distributing masks right now. Ben, I was just talking to Ben before the meeting and he was telling that we're out of masks, so we're gonna have to buy some more. So this is a good news. So.
Well, another thing too regarding masks, this is just something I've been in contact with several different people. We have a Muslim imam that meets at the Civic Building, although not right now, but they're producing masks right now with some tailors, and they are looking to donate some. So I didn't know you guys were in need of masks, but I can connect the both of you with the imam after that.
And Eric, there's also a video with a lovely young woman who demonstrates in French how to make a mask at home.
That's true. You know what? That's my wife. Thanks, Ken. I still appreciate hearing that.
I think we have somebody's making it, but Maimuna, Ben mentioned her name though. She's a nurse, so she's making for our community right now. But she's out basically. She was just telling us right now that we need more. So I don't think her by herself she can provide for everybody. So help is going to be very welcome. Thank you.
So we'll talk offline about that, but
yeah.
I want to link the both of you.
Okay.
This is a good question. Speaking in French, I know Tacoma Park has a large French-speaking population, West African population. Jessica, you know, I'm thinking about the radio show that they produce and updates, but your thoughts or anything that you want to ask or talk about?
Yeah, I mean, so things are evolving pretty rapidly right now, and we're trying to stay on top of all the state and county offerings, particularly in terms of small business assistance, housing assistance, and some of the resources that Ken mentioned. In terms of what we, the city, are offering, we are, like I said, we're in the middle of budget season, and so we're trying to identify additional funding to put towards our social support programs, but we do have we had some money available for small businesses as well as for housing assistance to promote housing stability. And I think what's going to be important is if we're put in contact with your information committee, because we have a newsletter and we also have a COVID-19 resource page on our website that's in French. All of our materials are available in multiple languages. And we're updating that constantly and sending out alerts through our newsletter. But also if we can be put in contact directly with your information committee, we can help provide information about opportunities that are coming up.
Okay. Wonderful. Harriet, thoughts, ideas? I know you work closely with the African community in all the different diasporas and countries, but are you seeing anything that you want to work with this nonprofit and how you guys can collaborate? I think you're on mute. Let's see.
Yes,
okay.
I'm here, Rick. Thank you. At the moment, we're having our mass production, and we have at least about 250, possibly by Monday. So we have been working to identify essential workers and make sure that they do have masks. So I would like to circle back with Ben and see how we could be of help. African Affairs is also donating. We're having tailors in place. Volunteers are putting masks together, looking for more if we can get, but we have tailors who are ready to sew, absolutely. And also, we work very closely with Sophie. I think you're familiar with Sophie, sharing all the count information. Some of the barriers that I found out is someone dedicated to review the information that has been shared and make sure that they are assisting those who might not necessarily have the understanding of that material so that they can access the information that is being shared. And also, like you said, being patient is key on some of the unemployment benefits. At this point, a lot of people do applying, but if you have a social media platform or like you mentioned, Facebook, I would like to be connected so I can continuously post this information. Yesterday, I was really focusing on promoting the public charge flyer with Ken that is highlighting that undocumented immigrant can access healthcare without any fear. That is not going to impact their green card application. That has nothing to do with that because the fear is there and people are afraid to access these services that are available. In addition to that, when it comes to testing all those with symptoms, we realize that majority don't understand when it comes to breathing issue. Breathing is a 911. You don't have to call or even wait for a referral. So we are passing this message to our communities that when you cannot breathe, you call 911 or access any emergency center that is close to you. Thank you.
Wonderful. Thank you, Harriet. You know, it reminds me of kind of Roberto. He covers a wide array of folks in Montgomery County, which, you know, Silver Spring and Langley Park and Tacoma Park, and there's just so Four Corners. It's all so very diverse. Roberto, what kind of work are you doing right now with folks that are undocumented or don't have documents or in it, you know, kind of out of the system and not necessarily participating? What are you seeing on the ground?
Well, what I'm definitely seeing on the ground, and I think Modi and Harriet went there, is the inherent lack of trust and the challenge that we have when public assistance can be provided, but it's contingent on personal information. And you know, we've had this situation for decades, but now it's really come to a head. So there is a clear distinction between, and we can provide you, and it's really, really good, a lot of information for use by individuals. We can provide you that, and hopefully you can help us get it to your community. The how to make a mask, where to get masks, call 911 in case of dire emergency, and all of that. So it's information for the use of individuals. We can get you that. The challenge is that resources for individuals that needs personal information, we can't go there. And it's only with your help. I mean, so here's where we're asking for your dire help in getting the message across. And at the moment, the public charge situation is like everywhere I turn to talk to with communities, undocumented communities, seems to be that folks are saying, no, don't apply for unemployment. Oh, don't apply for health. Yeah, no, my aunt said. And so how can we convey, and actually, and you may want to use some lawyers, immigration lawyers that you trust in your community to carry the message that filing for unemployment does not impede your process, your immigration process. It just doesn't. And so, but we can say that, yeah, but we're government. So please help us get that across, because frankly, filing for unemployment is the fastest and most expedient way we have to get real cash in our local community that comes from outside. So please, that message of apply for unemployment, it doesn't impede your immigration process, that alone is just, or your health access process, that's of immense need. So I'll leave it at that, but I'll recap by saying there's a lot of good information. Please help us get information for use by individuals. Where resources for individuals need personal information, that's much more challenging.
Yeah, and thank you, Roberto. One thing that is striking me is Ben and Modi. I'm going to ask you if you could follow up with me with an email as into what kind of information you would like us to provide, because we want to be a link to you as a resource. You know, when Ken had to jump off the call, but when he was talking about, you know, the first batch of funding is going to go to people we know, we want to make sure that funding gets to everybody, and that's really the you know, what Ken and what Harry and what Roberto and Jessica are all doing is trying to make sure that any county government, local government resources get into the people in most need. And so, you know, what you can share with me, I will make sure that we get answers and resources for you. And it can start with the need for masks, but anything else, I'm more than happy to help with that as well. As we kind of are looking to wrap up the meeting, I want to make sure that we do cover all questions and any other kind of thoughts that we want to put out there. So feel free to just jump in.
Thanks, Eric. Can I go?
Yes, please.
Yeah, thank you. So recently we found out that majority of essential workers from our communities would come back from work, and during the day, they're tired. That's when they're sleeping. And when you have those teen kids in the house and you're not supervising them, they're the kids who are out in the community meeting with a friend or two, even congregate more than 10, more than 20. And you have the risk, if these kids have been exposed maybe to a family member who has COVID, then continue to take it around the community. So we were urging parents to be very vigilant and make sure that they talk to their children and continue to share that messages and be the ambassadors as well. Thanks.
Thank you. Jessica?
I think you hit the nail on the head when you said we want to get you information on the issues that are most important to the Senegalese community right now. And so I think I think I can start by sending you our COVID-19 resource page. I think that's a good place to start. And like I said, I'm newer, so I'll certainly relay what has been said here to Mayor Stewart and to our city manager Ludlow. But are there Senegalese businesses within Tacoma Park? We want to make sure, for instance, that they're linked up with our economic development office that's creating grant funding and that kind of thing. So I think the contact has been made today, and the key is going to be to keep in touch, you know, from now forward.
Yeah, I 100% agree, because, you know, just making sure we're all in a room or virtual room together to be able to, you know, see each other and make those solid connections. Now, if Modi or Ben reach out to you, Jessica, you're going to know who they are, and vice versa for everybody here. That was the goal, my goal, for bringing everybody together in hopes that we had a nice, strong connection. Roberto? Oh, okay, he might be out of the picture. Modi or Ben, any last thoughts as we wrap up the meeting?
Yeah, I just want to say that I really appreciate this meeting, and I think that was a very important meeting. So, and then I mean, my thing is just information and resources. I mean, where we can go and get the information, the right information, and the resource. I think this meeting was very good. So it's a start. So because a lot of things that I didn't know, I know today in this meeting. So okay. Thank you very much. Yeah.
Wonderful, wonderful. And I want to work on getting those masks to you quickly. Yeah, last night was the start of Ramadan, and yeah. I think, you know, it'd be great to offer these gifts now to the community that so desperately needs it.
Thank you.
Roberto's back. Roberto.
Sorry about that. It just so no. Just wanted to ask you guys. I'm gonna. You're familiar with a little chat area on the conversation that in Zoom has the chat.
Yes.
Thing on the right. I wanted to put up there, we, for the Silver Spring Tacoma Park community, we release a newsletter that kind of like tries to capture in the Silver Spring Tacoma Park area some of what's going on. It augments the fantastic work that the city of Tacoma is doing and the work that others are doing. And so I just wanted to put it up there for you to please subscribe. That way you can stay in the know of what's happening at the hyper local level. Okay, so just I think I just I posted it up, trying to post it up to the chat. Okay.
Thank you, Roberto.
Yeah, but like Eric said, there's a lot of information out there, and we don't want to just throw a lot of information at you. We want to help you digest it. So to the extent that Ben and Modi, you can direct us in terms of what the priorities are in a given week. You know, that's helpful as well. That two-way communication there.
Absolutely.
And also, I guess we have, I forget, Eric, when you set this up, whether we all have each other's email or not. But to Jessica's point, frankly, we need to cut to the chase, if you will. And so, and you need to know, and please, and I think I speak for Ken, for Harry, for Eric, for everybody, for Jessica, everybody in the public sector. Sounds cliche to say, but we mean it. Nothing is too small. Nothing is too small. So whatever it is, send us a note, let us know, and we can certainly try to help. Yes, there's 311. Yes, there is the formal official channels, of course. And there's also the relationship channels that are very important.
Absolutely. Absolutely. And I'm here also to help. I send emails daily to the community. So please, I would be so happy to add you on the list, and I'll send critical information. Thank you.
And you know, one other thing too, and I'll just put this out there now. The radio shows that you guys are producing, Ben and Modi, it'd be great maybe if you could even invite Jessica on as a guest. Maybe, you know, she could talk about everything that they're doing in Tacoma Park, but she also speaks French, which would be, I don't know, is it in French or is it in English?
It's in French, Wolof, and English. So, but we can go with her in French.
Yeah, I'd be happy to.
Yeah. I would like to have that link if possible so we can share with the county, because we have a list of African media that would push information to all the PSAs. I would love that. Thank you.
Absolutely, we will do that.
Thank you.
So, do you want to?
It's just like amazing, and we are very happy and grateful to have people like you doing the work that you're doing. So I know a lot of people thank us, like, thank you, Ben, thank you, Modi. But I think the people to thank really are the people that are in front first, like you guys. And then in the second level, we come to you guys and share information and work together. And again, this COVID-19 shows us that we all live in a way or another. So this world is a small village, that anything that have a negative impact in somebody, it can impact all of us. So our interest is to work together, to put forces together, and then to serve people, because I think that's the most things to do in one's life, you know. So serving, and thank you so much for putting this together.